California has a long history of being a leader with regard to health policy. Many of you who were here, like I was, we know that California was the first state to actually launch our exchange. Proud that our governor agreed to expand Medicaid to childless adults to help reduce our medically indigent adult, which is how we used to refer to that population, the uninsured, by more than half. And I doubt very seriously if we're going to change our stripes now. So I want to quell any unrest my colleague from Orange County has about whether or not California will continue to be a leader, be it via resolution, protests, direct legislative action, budget action, or whatever. California will lead. I only put my mic up, Madam President, because I hadn't heard any of my colleagues talk about the most current news that came out today, and I think it's the news that many of us have been waiting for, and that is to recognize the information shared now by the Congressional Budget Office in terms of the impact of the new House Republicans' health care bill. So I won't go into details. I'm sure your staffs have white papers prepared for you to review. But in short, if the House Republican health care bill were to pass as it has been proposed to date, it will leave 14 million people by 2018 with no health care insurance. That number will grow to 24 million by 2026. The individual market will also be impacted. Within that first figure that I shared with you, the 14 million, 6 million people fewer would be covered under the individual market by 2018, but only 2 million fewer would be covered under this category by 2026. Again, the Congressional Budget Office estimated that more people would be driven to the individual market because fewer employers would offer insurance to their employees. So the question remains, from my perspective, if the individual market that we all tout as the optimal place for health insurance to be provided to everybody will be able to bear the sheer weight of the number of people who will have to seek it as their only option for health care. And I would question that seriously. I had the opportunity Saturday to be on a panel at the UCLA Healthcare Business Association at the Anderson School. There were about 300 or so healthcare providers, professionals, people who are in the business of providing healthcare. And as I looked out over the room with a very similar, quite frankly, demographic, looked at their academic achievements, looked at their job titles, they were CMOs, chief medical officers of major health plans and health systems, some representatives from DSH hospitals, disproportionate share hospitals, the chief medical officer from the entire UCLA medical system was there. And I looked out and I realized that perhaps many of the people in that room would benefit from the tax breaks being proposed by the House Republican bill. But it also occurred to me that given the impact the implementation of this bill would have on California, they would all pay one way or the other. Because as emergency rooms become the new place to receive your health care, all of us who are taxpayers in the state of California will pay, and will pay dearly. That's just looking at the bottom line financially, much less the issue of humanity and the humaneness of treatment and whether or not it's the appropriate place for people to receive their health care services. I want to thank the author of the resolution for the Health Committee information hearing that I attended as a Health Committee member in Bakersfield and the town halls he's convened throughout Southern California. I'm glad to be co-hosting with you in the coming months, because it's allowed me as a California policymaker to hear from the residents of California across the state, not just those who live in my Senate district, to hear firsthand, for me not to assume or listen to a segment of my constituents, about what role the Affordable Care Act played directly in their lives. To hear from presidents of DSH hospitals who say they will not be able to keep their doors open, and to remember the days when ERs closed in Los Angeles County, and ambulances had to drive and compromise public health to find an ER bed available to care for a California resident. When we read in the Congressional Budget Office's report about who would benefit from the passage of this act, and that would be 400 of the wealthiest families in the country who would receive a $7 million annual tax break, I wonder how many of those families are California residents. So as we stand here on the floor, whether we choose to acknowledge that we all have poor people in our districts or not, I wonder if we're really clear about who benefits and whether they're Californians or not. Because as I sat in the hearing in Central Valley, I was clear who stepped up, who talked about their very lives would be compromised by the elimination of the Affordable Care Act. There was not one representative from the 400 wealthiest families who talked about the benefit of the $7 million tax break would be to them and how they would then roll that out to the greater good for all California residents. We didn't hear from any of them, Senator Hernandez. So as we talk about the bill, as we reflect back on the Medicare Act of 1965, we really should think about legacy. What kind of California we choose to live in, what kind of California we choose to govern in, what kind of California we choose to leave for future generations. And is it a California in which the individual market cannot bear the sheer weight of the population and those in need of access to healthcare services? Or is it a California that will continue to be a leader, a progressive leader, in providing the appropriate healthcare services to the complexity and the uniqueness of the population here in California? We have a responsibility as California policymakers to govern based on what we know is best for our constituents. I'm not sure what the House Republican leadership is governing towards. I'm clear, based on the thousands of people who have shown up at town halls, who we've heard from in our own districts, in Senate Health Committee, that people want access to health care in their own communities. They want to know that the county hospitals and the disproportionate share hospitals in their communities will be open and available when they need them. They want to know that community-based clinics, either federally qualified clinics or Planned Parenthood, if that's your choice, will be open and available to provide critical services in their communities. And for those reasons, I intend to continue to be a representative of a leadership in California who will fight to the bitter end to make sure I provide that for the residents of this great state.